Welcome, everyone, and thank you for joining me today. If you're in the final weeks of pregnancy, chances are you've asked yourself one very important question. How will I know when I'm really in labor? It's one of the biggest concerns for expecting parents because movies, television shows, and even stories from friends often make labor seem dramatic and obvious. In reality, labor doesn't always begin with a sudden gush of water or intense contractions that send you rushing to the hospital. For many women, labor begins gradually. The first signs can be subtle, confusing, and sometimes even frustrating. You may notice tightening in your belly, mild cramping, pressure in your pelvis, or contractions that seem to come and go without a clear pattern. This can leave you wondering whether your body is simply preparing for birth or whether it's finally time to meet your baby. Today, we're going to explore the difference between practice contractions and true labor contractions, explain what's actually happening inside your body, discuss why labor can look different for every woman, and help you feel more confident recognizing the signs that labor is truly beginning. By understanding these changes, you'll be better prepared to make informed decisions, stay calm, and trust your body's incredible ability to give birth. Before we compare real labor with practice contractions, it's helpful to understand how your uterus works. Your uterus is one of the strongest muscles in your body. Throughout pregnancy, it grows dramatically, creating a safe environment where your baby develops over many months. As your due date approaches, this powerful muscle begins preparing for the work of labor. Birth isn't simply about pain or contractions. It's about a carefully coordinated process that gradually opens the cervix and helps guide your baby down through the birth canal. Every contraction has a purpose. They aren't random muscle spasms. Instead, they work together in a remarkable pattern that helps your baby move closer to being born. During true labor, the upper portion of the uterus contracts in a very organized way. These muscle fibers shorten and pull upward while gently pushing your baby downward. At the same time, the cervix begins to soften, thin out, and slowly open. This process is known as cervical effacement and dilation. Effacement means the cervix becomes thinner, while dilation refers to the opening becoming wider, so your baby can eventually pass through. With each effective contraction, your body is making gradual progress toward birth. This is why labor contractions usually become stronger, longer, and closer together over time. Each contraction is accomplishing an important task, even if progress sometimes feels slow. Now let's talk about the contractions that often create confusion during pregnancy. Braxton Hicks contractions. These are commonly called practice contractions because they help prepare the uterus for labor, but they don't actually cause the cervix to open in the same way true labor does. Many women begin noticing Braxton Hicks during the second or third trimester, although some may not feel them until the final weeks of pregnancy. Others may hardly notice them at all. Every pregnancy is different, and every body responds differently. A Braxton Hicks contraction usually feels like your belly suddenly becoming firm or tight. The entire abdomen may feel hard to the touch for a short period before relaxing again. Some women describe it as a squeezing sensation, while others compare it to the feeling of tightening a belt around the stomach. These contractions are often mild and uncomfortable rather than painful. They usually last less than a minute and disappear without causing lasting changes. While they can sometimes catch you by surprise, they are generally considered a normal part of pregnancy and are one of the ways your body prepares for labor. One important difference between Braxton Hicks contractions and real labor contractions is consistency. Practice contractions often appear randomly. You might experience a few during the afternoon, then none for several hours. They may happen after a busy day, following exercise, after lifting something heavy, or when you've been on your feet for a long time. Sometimes they become more noticeable if you're dehydrated or haven't eaten enough. In many cases, simply drinking water, resting on your side, taking a warm shower, or emptying your bladder causes the contractions to ease or disappear completely. Because they respond to these simple changes, Braxton Hicks contractions are generally not considered a sign that labor has truly started. Real labor contractions behave very differently. Instead of disappearing with rest or hydration, they continue despite what you're doing. At first, they may be mild enough that you can still carry on a conversation, but over time, they gradually become stronger. They begin following a more regular pattern. Instead of happening randomly, they may occur every 10 minutes, then every 8 minutes, then every 6 minutes, slowly becoming closer together. They also tend to last longer, often increasing from around 30 seconds to 60 seconds or more. Most importantly, each contraction feels more intense than the one before it, making it increasingly difficult to ignore. Another clue lies in where you feel the contractions. Braxton Hicks are often concentrated in the front of the abdomen. The tightening may stay mainly in your belly and feel more like pressure than pain. Real labor contractions, however, frequently begin in the lower back or wrap around your hips before moving toward the front of your abdomen. Many women describe them as waves that build gradually, peak, and then slowly fade away. Others feel intense pelvic pressure as their baby begins moving lower into the birth canal. Although every labor experience is unique, real contractions often involve more than just abdominal tightening. They tend to engage the entire lower body as labor progresses. It's also important to remember that pain isn't the only indicator of labor. Some women have extremely painful Braxton Hicks contractions, while others experience surprisingly manageable labor contractions during the early stages. This is why healthcare providers don't judge labor based solely on discomfort. Instead, they look at whether contractions are creating changes in the cervix. True labor is defined not simply by contractions, but by contractions that are producing progress. That's why someone may have frequent contractions for hours without being in active labor, while another person with milder contractions may already be several centimeters dilated. One reason labor can be unpredictable is that every pregnancy is different. First-time mothers often experience a longer early labor because the cervix is softening and opening for the first time. Women who have given birth before may notice labor progressing more quickly because their bodies have already gone through the process. Baby's position also plays an important role. If your baby is well positioned with the head facing downward and tucked toward the chest, labor often progresses more efficiently. If the baby is facing upward or slightly turned, contractions may still occur, but progress can sometimes be slower until the baby rotates into a better position. Many women become anxious in the final weeks of pregnancy because they analyze every sensation they feel. Every cramp, every tightening, every unusual pressure makes them wonder if labor is finally beginning. While it's completely understandable to feel excited, it's equally important to avoid becoming overwhelmed by every small change. Pregnancy is full of new sensations. Your body is constantly preparing for birth, and not every discomfort means labor has started. Learning to observe your body's patterns instead of reacting to every individual contraction can help reduce unnecessary stress and make the final days of pregnancy feel much more manageable. One helpful approach is to pay attention to how your contractions change over time instead of focusing on a single contraction. Ask yourself whether they're becoming stronger, whether they're lasting longer, and whether they're getting closer together. Notice whether walking makes them more intense or whether resting causes them to disappear. Observe whether you're able to continue talking comfortably during contractions or whether you need to pause and breathe through them. These patterns often provide more useful information than the intensity of a single contraction. Finally, remember that your due date is only an estimate, not a guarantee. Some babies arrive before 40 weeks, while others take a little longer. Your body and your baby are working together to determine the right time for labor to begin. Trust that preparation is happening even when you can't see it. Every Braxton Hicks contraction, every small change in your cervix, and every adjustment your baby makes is part of the remarkable journey toward birth. In the next part of this guide, we'll explore how to recognize when early labor is progressing into active labor, what you can do at home to stay comfortable, and the signs that it's time to contact your healthcare provider or head to your birth location. As labor moves closer, one of the biggest challenges many expecting mothers face is figuring out whether what they're experiencing is truly the beginning of labor or simply another phase of their body's preparation. It's completely normal to second-guess yourself. You may time your contractions for an hour, only to have them slow down. You may think it's finally happening, only to wake up the next morning feeling almost normal again. This can be emotionally exhausting, especially if you're approaching or even past your due date. The important thing to remember is that your body isn't failing or sending mixed signals for no reason. In many cases, these experiences are simply part of the natural transition into labor. Pregnancy is not like flipping a switch. For many women, labor unfolds gradually, and your body may spend several hours or even a couple of days getting ready before active labor truly begins. This stage is often called early labor. During early labor, the cervix starts softening, thinning, and opening little by little. Contractions may become more noticeable, but they are usually still manageable. You might find yourself able to talk through them, prepare meals, tidy the house, or even get some rest between contractions. Although this stage can feel slow, it plays an incredibly important role. Every contraction is helping prepare your body for the more active phase of labor. Rather than becoming discouraged because things aren't moving quickly, try to think of early labor as your body's warm-up. Just as athletes prepare before a race, your body is preparing for one of the most important events of your life. One mistake many first-time parents make is rushing to the hospital too early. Understandably, excitement and nervousness can make every contraction feel significant. However, arriving too soon may actually make the experience more stressful. If your cervix hasn't changed enough, your healthcare provider may recommend returning home until labor becomes more established. This can be disappointing, but it doesn't mean your body isn't making progress. Sometimes the most comfortable place to spend early labor is in your own home, where you can move freely, eat light meals if allowed by your provider, stay hydrated, and relax in familiar surroundings. Creating a calm environment during early labor can make a remarkable difference. Dim the lights, play relaxing music, practice slow breathing, or spend time with supportive family members. Walking around your home, gently swaying your hips, sitting on a birth ball, or taking a warm shower may help you stay comfortable while encouraging your baby to continue moving into a favorable position. Every woman's comfort measures are different, so don't feel pressured to copy someone else's birth experience. Listen to your body and choose the activities that help you feel calm and supported. Hydration is another simple but often overlooked part of preparing for labor. During pregnancy and labor, your muscles, including the uterus, work much more efficiently when your body is well hydrated. Dehydration can sometimes trigger uterine irritability, leading to contractions that are uncomfortable but not productive. Drinking water regularly, especially if you're experiencing tightening throughout the day, may help reduce unnecessary contractions. Eating light, nourishing foods, when appropriate, also provides energy for the work your body is about to do. Labor is physically demanding, and maintaining your strength can help you cope better as contractions become stronger. Rest is equally important. Many women feel the urge to clean the house, finish organizing the nursery, or complete last-minute tasks as labor approaches. While preparing your home is understandable, exhausting yourself just before labor isn't ideal. If contractions are still mild and irregular, try to sleep or at least lie down and relax. Even if you can't fall asleep, allowing your body to conserve energy can make a significant difference later when labor becomes more intense. Think of your energy as something valuable that you'll want available during active labor and pushing. As contractions become stronger, you'll likely notice that they require more of your attention. Instead of casually talking through them, you may naturally stop what you're doing, close your eyes, focus on your breathing, or lean against a wall or countertop until the contraction passes. Many women describe labor contractions as waves. Each wave slowly builds in intensity, reaches a peak, and then gradually fades away. Between contractions, there's usually a break that allows you to recover before the next one begins. These resting periods are just as important as the contractions themselves because they give both you and your baby time to recover. Breathing techniques can become extremely valuable during this stage. Slow, controlled breathing helps reduce unnecessary muscle tension and encourages relaxation. When people become frightened or anxious, they often hold their breath or tighten their shoulders, jaw, and hands without realizing it. This extra tension can make contractions feel even more uncomfortable. Instead, focus on keeping your jaw relaxed, your shoulders loose, and your breathing steady. Many childbirth educators teach the phrase, relax your jaw, relax your body, because tension in one area often affects the rest of the body. Although breathing doesn't eliminate contractions, it can make them much easier to manage. Another factor that influences labor progression is your baby's position. Ideally, your baby's head settles low in your pelvis, with the chin tucked toward the chest and the back facing the front of your abdomen. This position allows the smallest part of the baby's head to move through the pelvis more efficiently. However, babies are active right up until birth. Some rotate into an ideal position early, while others continue adjusting during labor itself. If your baby is slightly turned or facing upward, labor may still progress normally, but it can sometimes take longer or produce more back discomfort. Fortunately, changing positions, walking, gentle movement, and upright postures often encourage babies to rotate naturally. Sometimes women experience contractions that become regular and even painful, but then suddenly slow down or stop. This situation can be frustrating because it feels as though labor has started only to disappear. In many cases, this doesn't mean your body has done anything wrong. Instead, it may simply mean that your uterus needs more time or your baby needs to reposition before labor can continue effectively. Rather than becoming discouraged, try to view these pauses as part of the journey. Many mothers who experience this eventually go on to have healthy, uncomplicated births once labor resumes. It's also important to understand that every cervical examination tells only part of the story. While dilation is useful information, it isn't the only sign of progress. Your cervix may become softer, thinner, and more flexible before it opens significantly. Likewise, your baby may move lower into the pelvis even before dramatic dilation occurs. Comparing your progress to another mother's experience isn't helpful because every labor follows its own timeline. Some women dilate gradually over many hours, while others progress very quickly once active labor begins. Knowing when to contact your healthcare provider is another important part of preparing for birth. If your contractions are becoming consistently stronger, lasting around a minute, and occurring at regular intervals recommended by your provider, it's a good time to call. You should also contact your provider if your water breaks, if you notice heavy vaginal bleeding, if your baby seems to be moving much less than usual, or if you have concerns that something doesn't feel right. Never hesitate to seek medical advice if you're uncertain. Healthcare providers would much rather answer your questions than have you stay home worried about whether what you're experiencing is normal. Most importantly, trust yourself. You know your body better than anyone else. While medical guidelines and contraction timing are extremely helpful, intuition also has value. Many mothers later describe simply feeling that something had changed before active labor officially began. That feeling may come from noticing subtle differences in your body's rhythm, your baby's movements, or the intensity of your contractions. Listen to those instincts while also staying in communication with your healthcare team. Remember that labor isn't a test you can fail. There isn't a perfect way to recognize every stage, and it's completely normal to question yourself. Whether you go to the hospital once or twice before active labor is established, whether your contractions begin gradually or suddenly, or whether your labor is short or long, none of these experiences determine your strength or your success. Every birth journey is unique, and every contraction is bringing you one step closer to meeting your baby. In the final part of this guide, we'll discuss common myths about labor, practical ways to stay comfortable during active labor, signs that it's truly time to head to your birth location, and encouraging advice to help you approach childbirth with confidence and peace of mind. Thank you so much for spending this time with me today. I hope this guide has helped you better understand the difference between practice contractions and true labor, eased some of your worries, and given you more confidence as your due date approaches. If you found this information helpful, consider sharing it with another expecting parent who may also have these questions. Wishing you a healthy remainder of your pregnancy, a safe delivery, and a joyful beginning with your beautiful new baby. I'll see you in the next guide.